What is Q fever? Q fever is a bacterial disease caused by Coxiella burnetii. It is transmitted to humans through inhalation of infected animal products, such as birth fluids, milk, and urine. It can also be transmitted through ticks and through contact with contaminated surfaces. Symptoms of Q fever can include fever, headache, muscle pain, and a rash. In severe cases, it can lead to pneumonia and endocarditis. Q fever can be treated with antibiotics. To prevent infection, it is important to practice good hygiene when handling animals and to avoid contact with infected animal products. Causes of Q fever. Q fever is caused by the bacterium Coxiella burnetii, which is found in animals such as cows, sheep, goats, and ticks. It is transmitted to humans through inhalation of contaminated dust, contact with infected animals or their products, such as milk or urine, or bites from infected ticks. The bacterium can also be transmitted through ingestion of contaminated food or water, or through sexual contact. Q fever can also be transmitted from person to person through respiratory droplets or bodily fluids, although this is rare. Symptoms of Q fever. Q fever is an infectious disease caused by the bacterium Coxiella burnetii. Symptoms can vary widely and may include fever, chills, headache, body aches, fatigue, dry cough, chest pain, shortness of breath, sweating, rash. In more severe cases, Q fever can cause hepatitis, endocarditis, infection of the heart valves, and other complications. If you suspect you have Q fever, it is important to seek medical attention as soon as possible. Complications associated with Q fever. Some complications of Q fever can include chronic Q fever. This can occur when the infection persists for more than 6 months and can cause long-term health problems such as endocarditis, an infection of the heart valves, arthritis, and abdominal pain. Treatment for chronic Q fever usually involves a combination of antibiotics, and in severe cases, hospitalization may be necessary. It is important to follow the recommended treatment plan and take precautions to avoid spreading the infection to others. Pregnancy complications. Q fever can cause complications in pregnant women, including stillbirth, premature delivery, and miscarriage. Q fever can cause a variety of complications during pregnancy, including preterm labor, miscarriage, stillbirth, infection in baby, placental infection, etc. High blood pressure. Q fever can cause a condition called preeclampsia, which is characterized by high blood pressure and protein in the urine. This can be dangerous for both the mother and the baby. Cognitive problems. Some people may experience cognitive problems, such as difficulty with memory and concentration, after recovering from Q fever. Q fever can cause a range of cognitive problems in affected individuals. These may include memory loss, attention deficit, confusion, etc. Language problems. Some individuals with Q fever may have difficulty understanding or expressing themselves through language, including speaking, reading, and writing. Visual and spatial difficulties. Q fever may cause problems with visual perception, leading to difficulty with tasks such as reading or navigating unfamiliar environments. It is important to note that these cognitive problems are usually temporary and may resolve after treatment for the Q fever infection. However, in some cases, these problems may persist and may require ongoing rehabilitation and support. Liver damage. Liver damage caused by Q fever is typically due to the immune system's reaction to the infection. The body's immune cells release chemicals to fight off the infection, which can lead to inflammation in the liver. This inflammation can cause liver cells to die, leading to liver damage. Kidney failure. Kidney failure caused by Q fever is a rare but serious complication of the infection. It can occur when the kidneys become damaged by the bacteria and are unable to filter waste products from the blood effectively. Symptoms of kidney failure may include fatigue, swelling in the legs and ankles, shortness of breath, and changes in urine output. Treatment for Q fever-induced kidney failure may include antibiotics to kill the bacteria, dialysis to filter waste products from the blood, and medications to manage symptoms. In severe cases, a kidney transplant may be necessary. Prevention of Q fever. Prevention of Q fever includes avoiding contact with infected animals and their products, wearing protective clothing when working with animals, and practicing good hygiene. Vaccines are also available to prevent Q fever in at-risk individuals, such as farmers and veterinarians. Diagnosis of Q fever. Q fever is typically diagnosed through a combination of clinical presentation, laboratory testing, and serological testing. Clinical presentation. Q fever typically presents with fever, chills, muscle aches, and fatigue. Other common symptoms may include cough, chest pain, and difficulty breathing. Laboratory testing. Blood tests may be conducted to check for inflammation and to identify any underlying infections. Cultures may be taken to detect the presence of the Q fever bacterium, Coxiella burnetii. Serological testing. Serological tests, such as an enzyme-linked immunosorbent assay, ELISA, or indirect fluorescent antibody, IFA, test, can be used to detect antibodies to C. burnetii in the blood. These tests may be used to confirm a diagnosis of Q fever or to determine if an individual has been exposed to the bacterium in the past. Treatment of Q fever. Q fever is typically treated with antibiotics, usually doxycycline or a combination of doxycycline and rifampicin. These medications are usually taken for at least 2 weeks and can be effective in reducing the symptoms of Q fever and preventing further complications. In severe cases, hospitalization may be necessary to provide intravenous antibiotics and other supportive care. In some cases, patients may need to take antibiotics for several months to fully eradicate the infection. In addition to taking prescribed medications, it is important for individuals with Q fever to rest and avoid exposure to infected animals or contaminated environments. It is also important to practice good hygiene, such as washing hands frequently and avoiding close contact with others, to prevent the spread of infection. It is important to follow the treatment plan as prescribed by a healthcare provider to ensure the best possible outcome and prevent further complications. This video is prepared by Akram Jan Jafar for our website.